Welcome back to Eye Health Insights. I'm Dr. Joseph King, and today we're talking about cataracts, one of the most common causes of blurry vision as we age, and fortunately, one of the most treatable. If you're noticing glare at night, trouble reading fine print, or a general haziness to the world, cataracts might be part of the picture. Here's what we'll cover today: what cataracts are and why they form, the most common symptoms, when it's time to consider treatment, what modern cataract surgery really is like, and what I tell my own patients who are feeling unsure about the next steps. Cataracts happen when the natural lens inside your eye becomes cloudy over time. When we're young, that lens is crystal clear. It focuses light so we can see sharp, detailed images. But as we get older, proteins in the lens begin to change and clump together. That clouding scatters light instead of focusing it. Imagine looking through a frosted bathroom window instead of a clean pair of glasses. That's essentially what a cataract does. Cataracts are incredibly common. In fact, most people will develop them if they live long enough. They're a normal part of aging, not a disease you caught, and certainly nothing to be embarrassed about. Let's start with why this happens in the first place. Age is the biggest factor. The proteins in the lens simply change over decades of use. But there are other contributors too: sun exposure, smoking, diabetes, long-term steroid use, and previous eye injuries or surgeries. Some people also develop cataracts earlier than expected. I often see this in patients in their 40s and 50s, especially if they have a strong family history. Cataracts develop slowly, and the earliest signs can be subtle. Most patients describe blurry or cloudy vision, glare or halos around lights, especially while driving at night, or difficulty with contrast, fading colors, and frequent changes in glasses prescriptions. A very common complaint I hear is, "My glasses just don't work anymore." And that's exactly what happens when the lens is the problem, not the glasses. Cataracts don't always need treatment right away. Early on, stronger lighting and an updated prescription may be all that you need. The key question is, are the cataracts affecting your daily life? If you're struggling to read, having trouble driving at night, or finding that colors look washed out, it may be time to consider surgery. There's no benefit in waiting for it to ripen. That's an old myth. We decide based on function, not severity on paper. Now, what can you do about it? Cataract surgery is one of the most successful and commonly performed procedures in medicine. In modern surgery, we remove the cloudy lens and replace it with a clear artificial lens called an intraocular lens, otherwise known as an IOL. The procedure is typically painless. It takes just 10 to 15 minutes, and it's done under local topical anesthetic, sometimes with light sedation. Most patients notice sharper vision within days, if not immediately. There are several lens options. Some correct for distance, others will correct for near, and some offer a blend of both. During your consultation, we tailor the choice to your lifestyle and visual goals. One of the most common concerns I hear is surgery scary? And I always reassure patients, it's normal to feel nervous. But cataract surgery today is gentle, precise, and highly predictable. Another question is, will I still need glasses? Well, that depends on the lens that you choose and your eye health overall. We'll talk through all of that during your evaluation, so there are no surprises. Patients often tell me afterward, "I can't believe how bright and crisp everything looks. Colors come back. Night driving improves." Many people feel like they've regained a part of their independence. If you're noticing cloudy vision, glare, or difficulty with everyday tasks, a simple eye exam can determine whether cataracts are the cause. The good news is that treatment is safe, effective, and tailored to your needs. Thanks for watching Eye Health Insights. Take care and see you soon.